What's the real challenge of retiring early? Say 62, 58, even 55 years old. It isn't necessarily about having enough money saved. It's about crossing the two major bridges before you safely reach Medicare and Social Security. And the truth is, that's where a lot of retirees get stuck. They want to retire early, but they just don't know how to cover that gap. Now, they fear having higher Medicare premiums, which could cost them $15,000 to $20,000 extra, and their fear of draining their savings too fast because they haven't claimed Social Security yet. And that uncertainty keeps people working way longer than they need to. Now, later in the video, I'm going to show you how one couple retired at age 60 crossed both bridges and started living their dream retirement. But let's first talk about why most people underestimate these roadblocks. And if you don't know me yet, my name's Jeremy. I'm a certified financial planner, and I've been helping people successfully retire for nearly 30 years. Here's what I see all the time. Someone comes in and says to me, Jeremy, I've worked hard and I've saved $1.5 million. I think I'm ready to retire at age 60. On paper, the numbers look pretty good, but then the question hits them. How are you going to pay for health care until Medicare kicks in at age 65? And if you claim Social Security early at age 62, what's the impact on your lifetime income? And if you delay Social Security, how do you bridge the gap without draining your accounts too quickly? You see, this fear is what holds many people back. And I understand a wrong move can cost them tens of thousands of dollars, or worse, force them back to work. Now, these aren't side issues. They're the two biggest obstacles in early retirement planning. Now, stick with me until the end because later in the video, I'm going to show you how a couple, Tom and Lisa, tackled both gaps and how their decisions saved them tens of thousands of dollars. Social Security is often the first bridge most people think about. You can claim as early at age 62, wait until full retirement age, which for many people is age 67, or delay until age 70. But here's the fear. Retire before you're eligible, say at age 60, and you got a gap to cover. And why this matters is claiming early locks in a permanent reduction in your benefit. If you claim at full retirement age, let's say 67, and your benefits are $3,000 a month, and you decide to claim early at age 62, you may only get $2,100 a month. That's a $900 a month monthly gap forever. And what's important to know is this. If you're a higher wage earner, claiming early also slashes your spouse's benefits as well. And delaying requires you to fund the bridge years from your savings, which many people fear is going to deplete their nest egg and they're going to run out of money. Let me give you an example. Let's say you wanted to retire at age 60 and you didn't want to take Social Security yet until age 67 because you wanted a higher benefit. But you got 7 years of living expenses that you need to cover before you start your Social Security benefits. Now, if done right, it could be a very tax efficient move. But if done wrong, it can create years of anxiety and regret. Now, the key isn't just deciding when to take Social Security, it's planning on how to fund the years in between your retirement and when you claim Social Security. Now, in a moment, I'm going to show you how tax smart withdrawals made that decision way easier for Tom and Lisa later in the video. Quick pause here. If you're thinking about retiring early, these are the exact kinds of strategies we cover in my free training video on the Riverbend Bridge method. The link is in the description. It's designed to help you connect the dots between your savings, your Social Security, and your Medicare so you can retire without worry. Now let's talk about the second bridge. And this one surprises many people, and that is Medicare. Medicare begins at age 65. So if you retire before then, you're on your own for health insurance. And this is where many people panic. They heard horror stories about premiums and they worry that a single medical bill can wipe out years of savings. And why this matters is if you're age 60 and you're trying to cover the gap between retirement and age 65, and you go out and try to buy health insurance on the exchange, that could easily cost you $15,000 to $20,000 a year in premiums before deductibles. Now, if you retire early from work, you may be eligible for COBRA, but that usually ends after 18 months. So if you don't plan for healthcare properly, it can become the single biggest expense in the early retirement years. Let me give you an example. Mary retired at age 62. She thought she'd spend $5,000 a year on healthcare, but the reality was close to $18,000 a year until Medicare kicked in at age 65. That extra $13,000 cost came straight out of her retirement savings. And here's a twist. Sometimes the way you bridge healthcare costs can affect how much you pay in taxes. And I'm going to show you that in just a minute later in the video. Here's where the fear doubles down. These two bridges overlap. Let's say you retire at age 62. You're still 3 years away from Medicare and right on the doorstep from being able to claim Social Security. Every decision you make on one bridge affects the other. So, if you claim Social Security early to pay for healthcare premiums, it's going to reduce your lifetime Social Security benefits. But if you delay Social Security benefits, you'll need to fund your healthcare from your savings or other retirement accounts, which that could push you up into higher tax brackets. This is why so many people stay stuck in a job a lot longer than they want to. They simply don't know what to do. But when they do this, they fear moving forward, and that holds them back from a retirement they may enjoy. Let me give you an example. Tom and Lisa, the couple I mentioned earlier. They're both retired at age 60 with about $2 million saved. They were excited, but they're nervous about their 5-year gap to Medicare and their 7-year gap to full Social Security benefits. Here's what we did. After they talked to one of our healthcare specialists, they chose an ACA marketplace health insurance plan, carefully managing their taxable income to qualify for subsidies which reduce their Medicare premiums. We delayed their Social Security benefit all the way to age 70 and used a mix of their IRA withdrawals and taxable investments to cover their income gap so they could retire. By balancing withdrawals across their different accounts, we kept their tax brackets low and avoid the crushing IRMA surcharges later on Medicare premiums. The result was that they retired on time, their health care became affordable, and they maximized their Social Security benefit for life. This is why planning between the two bridges together is so powerful. It takes the fear out and replaces it with confidence. So you think about retiring early. Here's a framework to use. Map out a timeline. Write down your age today, your planned retirement age, when to take Social Security, and when Medicare begins, so you can see the gaps clearly. Next, price into the healthcare bridge. Get actual quotes for coverage between the ages of your retirement and age 65. Now, don't guess and get that cost so you can build it into your budget. And third, model in Social Security scenarios. Compare claiming at 62, 67, and 70. Look at the lifetime income benefit, not just the monthly checks. Remember, you have to think about your family's longevity and your spouse's benefits as well. And next, layer in tax planning. Early retirement can be the golden window for Roth conversions, capital gains harvesting, or drawing down pre-retirement accounts strategically. And 5, stress test this on your overall plan and model in. What if healthcare costs rise 10%? What if you live to age 95? Can your plan still hold up? Remember, the goal isn't just to cross these two bridges. It's to replace the fear of running out of money with the confidence to know that your plan really works. If you want to retire early and do it right, planning for Social Security and Medicare is a non-negotiable. If you want a step-by-step plan to replace uncertainty with confidence, check out the link to my free training video where I'll walk you through the Riverman Bridge method. I hope you found this video helpful, and I'll see you in the next video.